Well, we all want our neighborhoods to be happy and healthy, and here to help charge the way for that is Tammie Colon, the Executive Director of Mental Health and Recovery Services Board. Welcome, Tammie.
Thank you.
All right, so you guys got a grant. It's a nice sum of money to help with the services of our neighborhoods here in Allen County, right? Well, actually, more than Allen County.
Yeah, so we were very fortunate. We applied for a federal grant through SAMHSA, specifically targeting families who are impacted by youth who are acting violent towards family members and are oftentimes having to be removed out of their home. And so we have a very targeted population. We received $1 million. The board have to provide a very small match to that. And thanks to Coleman Health Services and our juvenile justice system, we're developing what we hope to be an impactful program.
Huh, very nice. So does this money cover other things as well, or is that the main focus?
Those youth are our main focus.
Yeah.
The beauty of having a federal grant, though, is in addition to those youth that are identified, we're also doing an extensive survey with other community stakeholders to try to identify what the real need is. Because while we know those youth who happen to get involved in the legal system, there are other families out there who are struggling with this, who don't want to use the legal system for fear of what that would bring to their young person. So we're really trying to look at this from a community perspective. That's what the federal grant wants us to do. What are your needs? Look beyond, serve those who you've identified, and look beyond to see what we can do for you.
Yeah, so part of this money, I guess, would go towards like an educational purposes to educate people of what,
Absolutely. We have to work with our law enforcement. Our juvenile justice system will be providing services that are prior to official court hearings. We'll be working with stakeholders, schools, other folks who work with youth and families to identify who may be at risk so that we can provide some early intervention services. When a youth is removed out of a home, despite what may have happened, it's extremely traumatizing for the family as a whole. For the youth to be incarcerated, for the parents to watch their loved one be removed, for siblings to watch their loved one be removed. And then what we have found is most of them return home the next day. Parents don't really want to press charges. Parents don't really want their child out of the home. They just needed some help in that moment. And our hope is that we can provide the supportive services to help them then and avoid all that complication trauma that comes with incarceration.
Yeah, so I kind of think of it as like kind of a domino effect, right? So once one domino falls, then you get the next and the next and the next, and it keeps going, but you're kind of there to stop that one domino so the others just don't keep falling, right?
That is true. And then also, though, to identify the individual who does need incarceration. I mean, we know that there are youth out there who are acting violent. We're not dismissing that or minimizing that, but there are so many more youth that are being bullied in school and they have a lot of frustration and aggression. And who do we take it out on? The people we love most, the people we feel safest with, and that leaves families unaware, without all the resources and the skills to manage that emotion that the young person is handling and having to engage in. And then when they go to jail, there's way more things that come than what a family is really anticipating.
Yeah, so I'm guessing this would be inpatient, also outpatient, and just everything involved.
Yeah, our goal is to get in there as soon as we've identified it, evaluate what the real need is. Aggressive behavior is oftentimes a result of hurt and fear. And again, always taking it out on the people that we care about most, right?
Yeah.
So what is the real issue? Is this a child that needs to be incarcerated, or is this a child in a family that with the right resources and support could heal and learn a better way?
Yeah, well, Tammie, thank you so much for coming on today. I always appreciate your knowledge and insight, and keep up the good work. I appreciate it.
Thank you. Yeah, we're excited. I appreciate you.
All right. Well, don't go away because medical news is coming up next.